Imagine waking up one morning to find you've gained 10 pounds overnight. You didn't overeat, you didn't drink, but your body? Unrecognizable. And then, your face begins to swell. Your eyes are nearly shut. You can't breathe properly. What would you do? What would anyone do? This is the true story of Linda Carlson, a 47-year-old woman from Ohio, whose life turned into a living medical mystery. Stay with us, because what doctors finally discovered will leave you speechless. Like and share, subscribe if you want more real-life medical mysteries that could save a life. Linda's alarm buzzed at 6:30 a.m., just like every morning. But today was different. Her body felt oddly heavy, not the usual tiredness after a weekend. Her limbs felt swollen, bloated. She tossed the covers back and sat up, immediately feeling pressure in her chest and arms. When her feet hit the floor, she winced. Her ankles looked thick, like someone had filled them with water. She shuffled to the bathroom, flipped on the light, and gasped. Her face, puffy, barely recognizable. Her cheeks looked inflated, lips full, and eyes nearly closed from the swelling. Her neck was wide, the skin taut. The scale delivered another shock. 163 pounds. She had been 152 the night before. 11 pounds gained. Overnight. Linda's mind raced. She mentally reviewed the previous day. No salty food binge. No alcohol. No medication changes. Something was deeply wrong. Audience question. What's the first thing you would do if you suddenly gained 10 pounds and your face looked unrecognizable? Rush to the ER? Try to sleep it off? Comment below. Wrapped in a hoodie and oversized sweatpants, Linda waddled into the ER with Mark by her side. Her breathing was shallow, and her rings were painfully tight on her fingers. The triage nurse raised an eyebrow, scribbled notes. "You think it's an allergic reaction?" "I don't know," Linda muttered, embarrassed. Look at me. I don't even look like myself." She waited 3 hours before a young doctor finally examined her. "Sometimes these things happen," he shrugged. "Could be a food reaction. We'll give you some Benadryl and fluids." Linda blinked. "That's it? Follow up with your primary in a few days. If it doesn't get better, come back." She was sent home with a printout titled, "Common Allergic Reactions and How to Manage Them." That night, the swelling didn't go down. It got worse. Linda's lips cracked. Her eyes were sealed halfway shut. Her pajamas stretched tightly around her. By 3 a.m., she was gasping for air. Mark was panicking. "We're going back to the hospital. Now." But Linda refused. "They'll just tell me it's allergies again. I need answers, not guesses." The next morning, her voice was raspy. Her breathing labored. Mark took more photos and sent them to Linda's sister, a nurse practitioner in Indiana. Within minutes, she called back. "She needs a full blood panel, urinalysis, and an emergency referral. This isn't a normal allergy. Push for tests. Push hard." Linda's family doctor, Dr. Howard Lyman, examined her with furrowed brows. After the intake, he tapped his pen. "Let's get some labs done. I'm ordering thyroid function tests, renal, panels, autoimmune markers. Something's off." Her blood pressure was slightly elevated. Her legs had pitted edema, meaning the swelling didn't bounce back when pressed. Audience prompt. Do you know what pitting edema looks like? It's often a sign of something deeper, kidney, heart, or liver trouble. Ever noticed this in your own ankles? By the next day, some labs returned. Elevated creatinine, high protein in urine, proteinuria, mild anemia, but the full picture still didn't make sense. Dr. Lyman raised an eyebrow. "We might be looking at nephrotic syndrome, or possibly an autoimmune disease. Either way, you're not going back home. We're admitting you." Linda was wheeled into a hospital room with a view of the parking lot. Her phone buzzed with messages from concerned friends. Her kids, ages 13 and 16, were being cared for by Mark and her mother. Every hour, a nurse checked her vitals. Blood draws became routine. So did the blood pressure cuffs, oxygen monitoring, and whispered hallway consultations between specialists. Then the diagnosis possibilities began to roll in. Lupus, Cushing's syndrome, heart failure, advanced hypothyroidism, all had overlapping symptoms, but none explained the rapid swelling plus sudden weight gain plus breathing difficulty. Then came a clue. Her TSH, thyroid stimulating hormone, was sky high. Her thyroid was failing, badly. But why? An endocrinologist entered the picture. Dr. Sonia Lin, a soft-spoken but razor-sharp physician, ordered additional antibody panels. Result? Antithyroid peroxidase antibodies. Sky high. Diagnosis: Hashimoto's thyroiditis, an autoimmune attack on the thyroid. But Dr. Lin wasn't satisfied. This doesn't explain your facial swelling to this extent. We're missing a piece. Another specialist, an immunologist, joined the team. He suspected a rare and dangerous immune condition, idiopathic non-histamine angioedema. 3 days in, Linda's breathing deteriorated. Her throat felt tight. Nurses called a code blue. She was whisked into ICU, intubated within minutes. For the next 24 hours, she lay unconscious, breathing through a machine. Mark sat beside her, holding her hand, whispering, "You're going to be okay. Just stay with us." After ruling out infections, tumors, and liver disease, the doctors made a desperate call. They tried rituximab, a cancer drug used off-label for severe autoimmunity. Over the next week, her swelling reduced. Her weight dropped back to 156. Her breathing normalized. She opened her eyes. Whispers of relief filled the room, but she wasn't out of danger yet. It took a week more of testing. The final diagnosis was jaw-dropping: Hashimoto's thyroiditis, TET-DTOM, Lyme-3, hereditary angioedema, rare gene variant, found via DNA testing. Membranous nephropathy, an autoimmune kidney disease. 3 rare conditions had collided, amplifying each other's symptoms. Linda's case? Only the 12th documented in the United States. Her chart was requested for a global medical conference. Linda now lives with monthly injections, a restrictive low-sodium, low-protein diet, regular blood tests and scans. She became an advocate, speaking to groups about medical gaslighting and the importance of listening to your body. Don't stop just because a doctor says it's nothing. If your body is screaming, scream louder. Her story is rare, but her lesson is universal. Push for answers, track your symptoms, trust your instincts. Like, comment, subscribe if this story moved you, and share it with someone who's battling invisible illness. Have you ever faced a baffling health mystery? Tell us below. Your story might help someone else feel less alone.